Thank you, Professor de Oliviera, for your time. Very impressive to see how South Africa shines nowadays with your discoveries. I have a couple of questions for you. Which of the key elements of your process, of your researches would you advise for the other countries to follow? I know you've been inspiring and helping European countries, but also Canada and many other nations. What is key for informing a country plan on the surveillance, of the genomic surveillance program?
Okay, so what's key? It is to do very similar what South Africa and the UK did from the beginning. Yeah, you create a national network with many labs close to government labs, so very easy access to sample, but all also sharing the same information in a database as a centralized resource. That's of crucial importance because that allows you to do continuous genomic surveillance weekly after weekly, sampling hundreds of clinics across the country, and all the information gets shared very quick with not only the network by the world. So South Africa took the example of the UK Genomics Consortium, yeah, and we implemented that here 11 months ago. We started in February 2020, and we have been surveying every week, and that's why allow us within weeks after appearing this new variant to have described it and then informed both our government but also the WHO.
A lot of interest into sequencing more in Africa for the benefit of the world and also to help nations and the continent as well.
Yes.
How would you scale that approach?
Yes, so that's also quite well developed. Yeah, we participate, or we help to coordinate with the Africa CDC, what we call the Pathogen Genomics Initiative, which Illumina has donated $20 million for that. That allowed us to set up labs in 52 African countries, but also have what is decentralized facilities to help to sequence very quick and train the other labs. So for example, our lab just finished with a week turnaround time, like hundreds of samples from Mozambique, and we have just sent the results yesterday, and today they are briefing the health minister about which lineages are circulating in Mozambique. We're going to be receiving samples of Malawi, Angola, Botswana, and Zimbabwe in the next few days. And the idea is that every week we're going to be putting like almost 50% of our virus sequencing throughput to help the other African countries. Yeah.
That's very impressive. What do you, in this consortium, we hear about the CDC of Africa, we hear this US CDC, yourself. How does that all work together in one joint plan?
Okay, so the Africa CDC is together with the World Health Organization. They are coordinating, and then they have labs in the African continent in 3 different tiers. One is called a specialized lab, and the lab that I direct, KRISP, is one of the 2 most specialized labs in the continent, and our responsibility is not only to support our region, but also the continental analysis and training of the data. And then the second tier, you have what is called the regional labs. For example, the NICD in South Africa or the Nigeria CDC, they are regional labs when they help not only their own country, but also the region. And then in the third tier, you have national public health institutes. So that's a way that we divide the specialities of the African continent on labs that are much more speciality and it can help the other ones, and then regional and national labs. And what we work, for example, with the other countries, that the sample selection is done by the Minister of Health of the country, together with the WHO, and then the Africa CDC do the logistic of shipment, not only of samples, but also reagents. And you may be aware that also Illumina have donated a lot of reagents that got to the countries through that system.
Absolutely. We started that very shortly after the first, beginning of the outbreak, first wave, as we call it. We also are working very hard on the PGI initiative. So we are very passionate about making a real impact on the continent. So what would be your ask for Illumina moving forward? After all we've done, are you still expecting more from us?
Yes, and you are very aware what's my ask for Illumina. So what we'd like to do through this Pathogen Genomics Initiative is to host some of the biggest sequencers or the biggest high throughput machines in the world, together with automatic robotic handling systems, which each of these machines can produce up to 3,000 genomes in a run.
Mm-hmm.
Yeah. So the idea is just to scale that and to support not only South Africa but also all the other African countries with one bigger facility, and also to use that as a training center. So that's something that we are very interested. For example, we had agreed both with Malawi, Zimbabwe, and Mozambique that the second batch of samples that they will send with their own technical people. So we're going to teach them on how to produce the data into our lab, because we also heard that Mozambique has received Illumina MySeq. So the idea is that over time, this our main center become not only a high throughput but also a training center, so genomics can be fully spread within the continent.
Yeah. That's the plan indeed. I have maybe one last piece of advice or question for you. It's more on the what are the biggest bottlenecks for a genomic plan across Africa? If we start from now, the second question might be also on the capacity needed enough for the whole continent. You said you would have a lab then that would be able to sequence up to 3,000 genome per day, but what would be the need on a weekly, monthly basis in this time now? And yeah, if you could, do you have any idea of that?
Yes, of course we have a lot of ideas. We have been planning that for a year. So what we see is three bottlenecks that we have to solve. The first one is very quick and accurate and comprehensive sample collections, yeah, and then shipment. Yeah. The second bottleneck, it is what we call on the library preparation. So these have to be done by automatic liquid handlers, robotic, to get the throughput. And the third bottleneck is in the bioinformatic analysis and feedback to the ministries of health. Yeah. Because what we want to do is to use genomics surveillance not as academic initiative but as a true public health tool. Of course, that SARS-CoV-2 or COVID-19 is one of the pathogens that affect the African continent. So the same we want to do with both like other pathogens such as other different viruses like HIV, Ebola, or measles, or hepatitis C is also a big problem, hepatitis B. We also have Zika, and then we also have after the bacteria that also cause massive disease and the parasites. So bacteria such as TB and XDR and MDR and parasites like malaria. So Africa, it is what suffered the biggest pathogen burden in the world. So it would be fantastic if we could have a proper genomic surveillance that could quickly identify and act against that variants as we have done in South Africa. And because we are here at the Durban Dubai Trade City, and that is another big project. That's one of the most exciting projects happen in the country. That's the Cornubia city. That's a high level, one of the smart cities in the African continent. And the objective here, that's a big project from both private and the government, is to also create a big pharmaceutical industry here, because it's also time that Africa don't depend of all the international countries to produce reagents, but also active compounds, drugs, and vaccines. So we also have to invest on bringing the technology here, not only to pathogen surveillance, but also to do the next steps from both treatment and vaccines.
Thank you very much. Maybe one last closing question. Do you think this COVID outbreak will be, let's say, helping countries improve and be more ready for the next one?
Yes, of course. So that's one thing that we hope South Africa become an example from the world. Very quick identification of variants, and also with both political and public health response. So I think that, and what I can see, for example, we are helping many countries via the World Health Organization to help to design the genomics pathogen program. Yeah. So it's very important that we're becoming a little bit better on that. Of course, South Africa, we have 20 years of pandemic of HIV and TB. So we got quite good on producing and analyzing pathogen data. It comes with a lot of experience. Yeah.
Thank you very much for your time.
Okay, thank you for flying here.
Congratulations again.
Thank you.